right. Oh, there we go. All right. Hi, my name is Natasha, and Natasha Frost, and I'm with the Public Health Law Center. We're located in St. Paul, Minnesota. It's a picture there without all the snow. And we are a national nonprofit that works on healthy food access, commercial tobacco control, and active living efforts throughout the country. And we try and work with different organizations, many of whom are in the room, through the equity lens. And what we know as lawyers and policy advocates at the Public Health Law Center is that laws and policies have often had adverse impacts on some of the most vulnerable people in our society. And so thinking strategically about how laws and policies can positively impact health inequities is a really critical part of our role. And that is where we've done a lot of work in the childcare setting. And so early care and education, which is what I'm going to be talking about today, is a lot of different things. This is a wonderful graphic done by one of our partners, Krista Scott at Childcare Aware of America. And it covers a lot of different settings, and we're going to focus today on licensed settings, or I'm going to focus today on licensed settings. But I just want to make sure people understand that early care and education means a lot of different things. It means essentially when a child is outside of the home of the parent, which is many of the children in today's working with parents who are working today. And it's really important for us to focus on this environment because half of all kids spend significant time in out-of-home care, in childcare. And so there's also a mechanism to impact these children. Unlike the home setting, childcare is regulated through a variety of ways, and so it's a really great opportunity to impact children at the earliest stages in that birth to 5 range. So we've talked a little bit about the federal options, and one of the things that we found in this setting is that it's really regulated at the state level. There's federal programs, but they're still implemented at the state level. And so you have state statutes, which are either the enabling statutes that kind of list out what the program looks like or who has control over the program, and then other statutes that have requirements. But really where this setting is regulated is through regulations at the executive branch, which is that blue section. And then court cases can interpret how the setting is regulated, although honestly, the majority of what we're looking at for early care and education, especially as it relates to sugary drinks, which was what we're talking about today, is done at the regulatory level, which is the executive branch. So today we're going to talk essentially about 2 key settings. One is centers, and so centers are generally outside of somebody's home, so they're in a facility and they have a greater number of children with multiple staff. Home-based care is a smaller number of kids. There's usually one primary caregiver or provider. Sometimes they have assistant, but it's a smaller number of children, and it happens in the provider's residence. And so those are kind of the 2 groups. But something to keep in mind is that they are very different depending on which state you're in, and we'll talk about that in a minute. So the policies available at the state level fall into different categories. Heidi showed you that great peacock, the spectrum of opportunities, and when it comes to policy, there are kind of three buckets that the work falls into through policy levers. There's funding streams. We've already talked about CACFP today. There's quality measures, and then there's kind of licensing and administrative regulations. Every state does this differently. It is really hard to draw general conclusions on anything because states just regulate all of these things differently. They do their funding streams differently. They have quality measures that are different, and licensing is different. So today I'm going to really focus on a project that we did for Minnesota and use that as the lens for some of this information. This is our website, and it has the information for this mapping project that was funded with Healthy Eating Research, RWJ funds, as well as Blue Cross Blue Shield of Minnesota funds. And what we did is we mapped the early care and education environment in Minnesota through a policy lens. And as you can see, it's really complicated. This is the Minnesota lens, and it's a funded program. When you look at whether or not sugary drinks, sugar-sweetened beverages, that level of detail is in our funded programs as a regulatory requirement. It just isn't. In the majority of states, that's not the level of specificity that's going into our laws and regulations. For quality measures, as Heidi said, sugary drinks isn't ending up in our quality measures that are impacting our child care settings. they're not going to that level of specificity. They talk generally. There's many states that actually talk generally about nutrition standards. There are a lot of requirements regarding water access, but as far as limiting or eliminating sugary drinks, that's just not as common in these quality measures. Where we're finding these regulations is actually through our licensing. And so licensing regulations are created usually by state statute, but it delegates the authority to the executive agencies to regulate childcare licensing in the state, and they define the settings. And so this is where we're finding specific information regarding sugary drinks. So what are states doing? Every state has a different definition of what a child care center is, what a family child care home is, but we've tried to group these settings as part of a collaborative project with Angie Craddock out of Harvard and Sarah Benjamin Nealon out of Johns Hopkins, and this is again an HER-funded project. And we looked at what are state licensing regulations related to sugary drinks, as well as many other healthy eating and active play and screen time factors. And what we found is there's not a lot of regulation, but there are some good examples. And so this is we had to group the centers and family childcare homes for purposes of this information. And so generally what we have found is that there is some activity around the states, across the states, that are working to eliminate sugary drinks. And just so you can, because it's very small, this is all on our website. The red is that there are not any regulations. The yellow is that there is voluntary or recommendations about sugary drinks, and then the green is the elimination of sugary drinks in the state regulations for that particular setting. We also have analysis on CACFP, as we said, or as has been previously said. The CACFP standards don't specifically eliminate sugary drinks as part of the meal patterns. They just don't get reimbursed. But this is a map that shows all the different states that have nutrition standards that are linked to CACFP embedded in the licensing laws. And the green is that they're actually going to update automatically. So with the new standards that go into effect in October, those states will automatically update for their nutrition standards. The yellow is that they're linked to CACFP, but they might not automatically update. And then red is where they are not linked to CACFP. One of the limitations with the way that we did this research is there are states that actually have very specific licensing standards that are not linked to CACFP, but they have really strong nutrition standards. Mississippi is a great example. They have a specific, as you can see here, they have a elimination of sugary drink requirement and licensing, but they don't link it to the CACFP standards. And so there are some states that actually have really strong nutrition standards, but is not captured in this map. We also looked at juice, and you can see there isn't a lot of specificity in the child care licensing regulations specific to juice, but there are a few states that actually have serving size limitations on the juice, 100% fruit juice. And then we have drinking water best practices. So this is a summary, and many states in their licensing regulations have specific regulations related to making drinking water available or made available throughout the day. One of the things that we're finding about drinking water is that the implementation is really where it gets complicated. For example, in Minnesota, which is green, there is a requirement of how the water is served. It's either a drinking fountain or it's required to be served in a single-serve cup, which is not it has to be a disposable cup. And so it's creating this interesting adverse effect of if you don't have a drinking fountain in your facility, that it is having a lot of waste. It's requiring a lot of negotiating when it comes to the child care centers. And so thinking about how these regulations are actually positively impacting the goal of increasing water access or negatively impacting the goal of water access is important. And again, we have some other data regarding drinking water being served. And one of the interesting things is the connection between as I think it's already been mentioned, CACFP does have a requirement about water being served, especially with the new updated standards. One of the things that we don't really know is whether or not if state licensing regulations require CACFP to be part of their meal patterns for licensed providers, whether or not they're actually also applying other standards that are part of CACFP, or whether or not it's just a very basic nutrition standard requirement. And so there's more work to be done in trying to figure out that interaction in the licensing implementation. The other thing you might see is you'll see gray. So California is gray when it comes to the sugary drinks, and that's because as part of our protocol, we looked at childcare licensing regulations. That is generally where states put this level of specificity regarding nutrition requirements for the settings that we're talking about. California is unique in many ways, but in regards to this topic, they actually have a statute, a separate statute that has the healthy beverage statute, which is a unique opportunity that is currently being studied by several folks in implementation to see how it impacts access to water, how it limits sugary drinks in the childcare setting. And I think it's a real interesting model for folks to consider in regards to impacting sugary drink consumption at the childcare level. But again, it's done through statute, not through their licensing regulations. Something that's really important when thinking about policy opportunities related to this area, specific to licensing, is really what you're trying to do. This is some great data from Child Care Aware of America, and it summarizes, they have a great report that summarizes the settings for each of the states. So you'll see Minnesota and Mississippi, and the reason that I wanted to highlight those two settings, or those two states, is because you'll see in Minnesota, the number of family child care homes is 9,249. The number of family child care homes in Mississippi is 9. So how many settings you're going to impact through your licensing, through updating the licensing regulations, is really important local context to understand. And every state, again, is very different. The settings are called something different, and they're defined differently. So one of the things that we found in Minnesota is that this is, we worked very closely with a lot of different advocates, and what we found is there were a series of folks working on the topic of nutrition in the childcare setting. And they were not necessarily coordinating with one another. They were trying to come up with different recommendations. And so thinking strategically about the setting as a whole and identifying those opportunities, not just with the childcare setting, but with other areas that impact birth to 5 in that age range, is going to be really critical when you're thinking about state-level policy interventions related to sugary drinks. The other thing to keep in mind is that, as I've been talking about state level, and we're going to hear from Kim, who's going to talk about New York City, but there is a limitation for what local level folks can do related to childcare licensing. Again, based on research that we did through Healthy Eating Research, we found that very few states actually have express authority to regulate the local level for the childcare setting. And so you need to be thinking about whatever policies you're impacting. If it's local level policy, you need to think about whether or not local level governments have the power to enact those policies through law, or whether they're going to be more programmatic interventions. And again, that could be found on our website. And then finally, I will just leave just this general context. The Public Health Law Center is working on a specific quality in family child care settings project that's really looking to think strategically about how quality is defined for family child care, much broader than nutrition. But I would really, just based on what we're finding, is there is definitely a stigmatism for family child care, and an even a higher level of stigmatism for family, friend, and neighbors, especially when it comes to nutrition and quality. And there's assumptions built into what we're talking about, and what we know and what we don't know regarding what's being served in family child care and family, friend, and neighbor settings. And so there's more studying to be done and more data that needs to be gathered to figure out, are sugary drinks being served in family child care or family, friend, and neighbor? And it's really important for us to keep that context in mind when advocating for different policies on the state level policy, on the state policy level. Thank you very much.